Hi everyone, my name is Anita and I'm a nurse. Today I'll discuss the key barriers that inhibit workers with low back pain from returning to work and ways in which these barriers can be overcome. The significance of lower back pain. Low back pain is one of the main causes of occupational work absence on a global scale. The majority of cases are non-specific and improve with activity, yet less than 50% return to work if absent for more than 6 months. Many employees struggle to resume employment due to a combination of personal, workplace and system level obstacles, which can result in significant economic and societal costs. What are the main causes of work-related lower back pain? Exposure to constant vibrations from machinery, prolonged sitting periods at a desk or while driving, lifting heavy or large loads can all cause back strain on the spine and the surrounding muscles. Falls or acute injuries can also lead to back problems, while stress and anxiety can intensify muscular tension. From this list, we can see that back pain can be associated with a variety of occupations, such as from the office worker to the construction worker. Biopsychosocial barriers, which includes biological or physical barriers, psychological barriers, social or occupational barriers, which are such as the healthcare system or the workplace. When combined together, these can contribute to frequent work absenteeism. They mutually reinforce and I will further discuss them in the coming slides. Low back pain is seldom or purely a physical issue on its own. Biological or physical barriers. Pain severity and persistence, which limits mobility and endurance. Flare-ups with sitting or standing or twisting. Structural and degenerative changes, for example, disc herniation, spinal stenosis or osteoarthritis. Inflammation around the joints, which often leads to swelling and hypersensitivity, increasing pain during tasks. Neurological symptoms like numbness or tingling sensation. Inadequate sleep due to pain, causing fatigue, reducing concentration and reaction time. Muscle spasms and guarding, which restricts movement and increases fatigue. A limited range of motion leading to difficulty in bending and reaching and spinal rotation. Often stiffness, slowing work performance. Reduced physical capacity, for example flexibility. Medication side effects, again causing drowsiness and reduced alertness. Deconditioning, for example, muscles weaken and endurance drops. The psychological barriers. Low self-efficiency, feeling unable to cope with pain or perform tasks. Catastrophizing, pessimistic thoughts leading to slower recovery and return to work. Fear avoidance beliefs. Fear work will worsen the pain and cause re-injury. Depression and anxiety, low mood, leading to reduced energy, reduced motivation and work readiness. Maladaptive beliefs about pain, believing that when they have pain that they're causing further harm. Inadequate coping strategies, excessively resting and withdrawing from activity. Workplace related fears, such as job demand, lack of modified duties or lack of supervisor support. Lack of clear guidance, reassurance and contact from the employers during absenteeism. Workplace barriers include physical demanding tasks, poor ergonomics and exposure to whole body vibration. Psychological factors, as just mentioned previously. Organisational challenges like limited or modified duties. Inadequate communication and poor planning on return to work. Inadequate workplace interventions like unclear safety levels and the lack of guidance can further impede successful reintegration when returning to work. Healthcare and social barriers. Delays in access to care, such as diagnostic services, imaging, physiotherapy. Inconsistent or ineffective clinical approaches. Fractured communication between various healthcare providers. Lack of multidisciplinary rehabilitation services. Restricted availability to occupational health services. Insufficient patient or inadequate patient education. Inadequate assessment of the psychological factors. And financial or insurance barriers can all lead to a delay in the return to work. Recommendations to overcome returning to work barriers. Employers should provide early communication and support with the employee. Encourage early mobility and physiotherapy. Treat any underlying physical or psychological conditions, for example, obesity, depression. Provide stress management support and services, for example, CBT therapy. Gradually return employees to work with reduced hours, modified duties or light duties. Encourage and allow for regular breaks during the day. Educate on pain management and safety, for example, providing a manual handling course. Ensure there is coordinated care and open communication at all times between all shareholders. Ergonomics, providing lumbar support, or maybe need to make the necessary seating and workstation adjustments. To conclude, most lower back pain is not dangerous. Barriers are biopsychosocial. Early return to work is safe and beneficial. Addressing these barriers improves the outcomes. Returning to work after lower back pain is most successful when biopsychosocial barriers are addressed together. Research shows that early activity, modified duties, and strong communication between all parties reduce disability and improve the long-term outcomes. Tackling fear avoidance, beliefs, and providing ergonomic and organisational support creates a safer, more confident transition back to work. Thank you.